Hello guys, my name is Favor and I'm a member of the Mother Care Initiative. Mother Care Initiative have been in this period talk on maternal mental health, things like postpartum depression, postpartum psychosis, and postpartum obsessive compulsive disorder. But for this video, I'm talking on the postpartum obsessive compulsive disorder. To begin with, let me tell you guys what postpartum is. Postpartum is the period after childbirth. Could range from 6 weeks to 6 months or a year, depending on your breastfeeding time and also hormone. And obsessive compulsive disorder is an anxiety disorder that's to do with obsessions and compulsion. Obsessions are thoughts and ideas or unwanted mental images that constantly preoccupies a person's mind. While compulsions is the urge or irresistible urge to do something in a certain way. So when a person experiences this obsession, this compulsion after pregnancy, is termed postpartum OCD. Postpartum OCD is a type of postpartum anxiety disorder that is characterized by intrusive thoughts and ideas or behaviors that is in response to a perceived danger towards the baby. So this obsession, this compulsion is just about the baby and it's just for the postpartum period. It doesn't exceed the postpartum period. We don't have lots of recorded cases for this condition, not because it's not a serious condition, but because people don't come to the hospital with this condition, either because they're embarrassed or they feel they'll be labeled as someone with a mental disorder, and also it can be misdiagnosed as well. It can be labeled a postpartum psychosis. So people don't come to the hospital with this, just prefer to suffer silently. And we have new fathers that have been seen to suffer from this condition as well. So it's not just mothers alone. There are certain conditions that can predispose one to developing this condition. Things like a previous history of OCD and also a family history of anxiety disorder. Infertility as well can lead to this. Just imagine staying so many years without a child and then the child comes. You'll be overly concerned about the child. This can actually lead to OCD. And also a previous history of trauma as well, and unwanted unplanned pregnancy can also lead to this. There are certain obsessions, certain symptoms that you could see in a woman that you say, oh, this is postpartum OCD. You could see someone who is constantly worried that she will drop her baby, so she doesn't want to be left alone with the baby, or someone who feels that her baby is always contaminated with toxins, so she's constantly bathing the baby, or someone who has mental images of her sexually abusing her baby, either while changing diapers, her hand just slip into the baby's private part, so she just doesn't want to be left alone with the baby. Or you could see someone who thinks that her baby is suffering from a terminal disease always, so she always takes baby to the hospital for checkups, and you see them always repeating certain phrases like, my baby is fine, my baby is fine, my baby is fine, over and over again, just to remind themselves that this is not real. Is all in their mind or all in their head. Or someone who feels that her baby can die in his or her sleep, so she sits by the crib constantly checking on the baby breathing, baby okay. No, she doesn't sleep herself, she just stays by the baby's crib. Or a woman who removes all dangerous or harmful objects in the house, like knives, like plates or chemical, just removes it. Or a woman who is praying with urgency, see her always praying, always praying. Sometimes we may just attribute that to maternal instinct, but you could see that, oh, this is not normal, this has gone beyond normal now, this is not a problem. And women know when they are suffering from this condition. It's not as if they don't know, they know, but like I said before, they prefer to suffer silently. And also sometimes we notice it in our friends or in our spouse, but we just tend to overlook it. Like, okay, I think it's just because she's a new mother, or just because he's a new father, or just because I just think she's just protective of her child. But some of these things we should look out for them and like encourage them to come to the hospital, because it's not something that they should sit at home and just suffer. It's something that is treatable. For the treatment, therapy in combination with drugs have been seen to be helpful. Drugs like the antidepressants, like the SSRIs, that's the selective serotonin reuptake inhibitors, like sertraline or fluoxetine, in combination with cognitive therapy, have been seen to be really helpful for this condition. And also drugs like the anti-anxiety drugs like benzodiazepines and also antipsychotics as well. So these drugs and therapy together has been seen to really be helpful. So there's no need, like I said, to suffer in silence. Just come forward, ask for help. You can talk to your obstetrician, you can talk to your family member, you can talk to your therapist, anybody you feel comfortable with. Talk to the person. That's it for this video, and I hope you find this video helpful. And please look out for one another out there. Thank you, and God bless.